we need more patients in the program because although we're able to meet the demand, what you'll see across states is like those numbers are much higher. And we usually compare ourselves to Arkansas, and their numbers, although they're producing, they still are not really doing well with the numbers. And they're, I want to say that we're a tenth of that number that they have. So we do need to increase the number of patients in this state to have a lucrative program.
But how does somebody submit themselves to the program? Is this something where they're doing it through their treating physician and getting the script?
So that is correct. So as of August 1st, 2020, the program was opened up to any individual who felt they needed medical marijuana. So it's no longer where you have to be under a specific debilitating condition or anything like that. Anyone can be on the program that wants to be on the program. And it ranges from anxiety to AIDS, so if you feel the need to be on the program, you can sign up. And just by letting your physician know, and if that physician does not, or is not a part of the program as a prescriber, there is information on the website, on the SUAG Center website, where you can actually go and, get with a physician who can prescribe it for you.
Okay. Doctor?
One of the pushbacks or issues that we're having with medical marijuana is many of the physicians aren't educated on it. So patients are requesting and asking all the time. So I think what Southern will play a key role is, I'm not even sure Southern's LSU's board has a physician that's actively engaged, but we're trying to put out educational information so that the community can understand what's available, how it works, addictive potential, all of the, dispel some of the myths about medical marijuana. So that's what we're going to play a key strategic role. My vision and dream is for us to do an educational seminar on the campus for physicians across the state, whether it be virtual or on the campus, so we can teach the physicians about it, because there's pushback from the physicians. There's a demand for it now. Yes. And with them increasing the delivery types, now we have the medibles and everything else, and probably pretty soon the leaf will be available. When you have the delivery types increase, the physicians are not willing to dispense or to recommend. They're not going to. You're not going to increase that patient volume. So that's the pushback has been on the physician side, not on the patient side. I think I'm correct.
That's correct. And what I failed to mention as well is that we are positioning ourselves for this the demand of the market. So we are hiring drivers who will actually be able to deliver these medicines to the pharmacies. So we're being proactive in our approach.
Are we moving through our individual satellite campuses to say that I can probably feel your numbers between New Orleans VA hospital and some of our pharmacies down in New Orleans? I'm just wondering to what degree we're reaching out to our individual campuses and saying, hey, maybe we do outreach through Sussler or Suno and say, hey, look, this is the product that we've got. Let's get these doctors involved.
Yes, and that's part of the plan that Dr. Whitfield is working with us on, making sure that we are able to get this across and hold these seminars on these various land masses.
Okay. Any other questions from the board?
Quick question. I know you may not have the information right now, but I heard the gross revenue. I'd like to get maybe something that will give us the net revenue. I'm kind of curious about our expenses versus the profitability.
Yes.
I'm not going to put you on the spot and ask you now.
Okay.
And that's understandable that you may not have it right now.
Thank you.
The other question was tied into what our very informed colleague just said, Dr. Whitfield. Is there any prohibition or probability of putting maybe a mobile pharmacy out there? Because for instance, you have one in Alexandria, but there are a whole lot of folk in between Alexandria and the next location that may not be exposed and quite frankly, kind of place bound and would probably enjoy that service. And so is that a prohibition?
So right now we are not allowed to do that because we only have 9 licensed pharmacies in the state. Now, as that number and that's legislatively. So if those numbers continue to grow as far as the pharmacies that, they can administer, where they can administer, then, that would help us out greatly. But right now, due to those legislative matters, we can't move on that.
Yeah, I noticed
Yeah.
Not only for more, but also for more minority-owned dispensaries.
Yeah.
So there's been a big push, as well as having Southern Knights involved in it as well. So
Mhm.
it's some stuff moving, and some moving parts going on.
Mr. Hilliard had a question.
Yes. Okay. On the website, it's kind of tucked away under research. Is there any way we can call this? I mean, I like the part where you have program areas. So it's kind of an active program now. So, you know, it would be easier to find on the website if you just said like active programs or
Okay.
program areas. And then the last piece there where you said the list of the medical, the pharmacies,
Mhm.
I can't find it at all.
You
I
don't see that one?
I
Okay.
don't see it.
I'll check with them, but
Yeah.
we've had discussions as far as putting that, because a lot of people have come to us. I'm not going to say a lot, but a few people have come and said that they have to navigate, and so we're going to make it plain on the website where they're able to access that.
Okay.
Thank you.
Any other questions from the board? The last thing will be, will the edibles be ready for the board retreat?
We're working on them.
Oh, okay, thank you.
Thank you.
Thank you. Well, now we'll move to our assistant president's report. Who's going first?
Oh, I'm sorry. Thank you, members of the board, Mr. Vice Chair. I have nothing further to report at this particular time. Thank you.
Thank you, Mr. President. Now we'll move to our individual campus reports. Dr. Evans.
Mr. Chairman, members of the board, I know there will be other times that we will have opportunities to express our thanks and appreciation to Dr. Belton for his stellar leadership of this system, for the Southern University and A&M College system. But I thought I'd just have to pause and say to him how much I appreciate his leadership and his friendship. I came to the system a little over 3 years ago, and I came because I wanted to work with Dr. Belton, and I wanted to serve this system to the best that I could. And I want to express to him publicly my appreciation for the opportunity that he provided me to come and be a part of this great system. And I look forward to the year that we have ahead of us. As I told him in a conversation a couple of days ago, we still got another year, and we still got a lot of important work to do. And I look forward to that. And again, I want to thank you for this opportunity. Sure. Thanks. I also want to report on the success of the DXC and the IBM partnerships that this system enjoys. We are now seeing great benefits from those partnerships. We are now seeing students from across this system, and more recently at Southern University at New Orleans, not only receiving the instruction from our professors, but passing the rigorous exams like Amazon Web Services, one of the certifications that is in high demand all across the globe. And I just want to stop in and say how important those relationships are and how beneficial they are to making our students more competitive in this global marketplace. Also, too, a couple of months ago, we had a presentation on esports. And I want to report that Southern University at New Orleans is now putting on a summer tournament series in esports. We have our students, our faculty, our administration and staff, the entire community has embraced esports. And so just keep watch for the summer tournament series that is underway now. Also, too, I'm pleased to report that the Council on Social Work Education informed me 2 days ago that both the bachelor's and the master's of social work at SUNO have been reaffirmed. Their accreditation has been reaffirmed for the maximum 8 years, both programs. And I want to extend my congratulations to Dean Chason, the faculty, the staff, and students of the School of Social Work on the SUNO campus. The other thing that I want to say is that the Board of Regents is now in the process of they will decide on policy changes to how new degree programs are approved across the state. This new approach that we have been asked to make comments on, in my opinion, although I am seeking the input from our vice chancellors across the Southern University system, but this new process that will likely be approved, Dr. Tarver, is going to streamline that process. Right now, that process it includes several steps with the letter of intent. You may recall I came with the letter of intent. I came back with a full proposal. The proposals had to go out across the state. There is going to be a new approach, but what I really think is going to make a difference, and especially for the historically Black colleges and universities across this state, is that we will have the opportunity to develop a 3-year plan for new degree programs. So we'll be able to put a stake in the ground and say that these are our areas of expertise. These are the areas that we are going to pursue to develop new degree programs in. And I just want to encourage my colleagues, the chancellors and the vice chancellors for academic affairs across the system, the Southern University system, to take a look and provide feedback to me so that I can provide feedback to the Board of Regents. And then the last thing that I want to say is that on Monday, I will be meeting with Ochsner Health. As you know, the plan for all of our institutions is to come back face-to-face in the fall. I have expressed my concern to Ochsner about the surge in this Delta variant of COVID and the possible risk to our ability to bring our students and our faculty back to the campus in the fall. And I know that there are going to be conversations with health providers, with chancellors, with the president, with chancellors across the system. And I do want you to say that we take this very seriously. We are going to seek medical advice. We're going to do our part in terms of encouraging and even providing incentives for young people, especially to take the vaccines that have proven to be safe against COVID-19. But this is a concern, and I want you to know that we are taking it extremely seriously. And I'm certain that the president and the chancellors and myself will come back to the board on our plans for reopening our campuses to our students and our faculty in the fall. So, Mr. Chair, that concludes my report.
Thank you, Dr. Ammons. Chancellor Ellis.
Mr. Chairman, the board, Dr. Belton, and my colleagues, the Susla Chancellor's report is included. I do want to acknowledge a couple of quick things. As part of our community efforts, we have broadened our STEM camps to the community students from K through 12. On today, and the reason I mentioned this as one of the camps is that today we have students from kindergarten to the 12th grade presenting final projects in areas such as artificial intelligence, robotics, coding, and digital design, which for those underserved communities is extremely important as we evolve in our economy. I also want to mention that we received another $50,000 from Home Federal Bank as part of our $2 million campaign for the Roy Griggs School of Business, which has brought us up to, I believe, about $600,000 toward that goal. And finally, I do want to, again, acknowledge Dr. Belton for his leadership, his advisement of me. I as well spoke to him a couple of days ago and publicly told him that, his leadership for my style of leadership was just, very congruent. He advises, but he doesn't, tell me what to do. He presents things in a way that gives me an opportunity to think and to critically analyze situations. And I just appreciate that style of leadership. I also want to thank him because I had a monumental task of coming behind him at Susslin. And the success that I have had there undoubtedly could have been achieved without the foundation that he laid. And so I just want to publicly thank him for his leadership, his guidance, and the stellar institution that you left me in Sussex. Thank you.